In today's video, I'm going to show you how to count the length of your menstrual cycle, how to calculate your safe days and fertile days if you have irregular cycle lengths. Hi, my name is Dr. Thecla. On this channel, we discuss everything women's health. If that sounds like something you'd be interested in, please subscribe to the channel. You can get a paper and pen and calculate alongside me so that you understand what we are doing much more clearly. Now, to count the length of your menstrual cycle, you start counting from the first day bleeding starts to the last day before your next period comes. Let me show you that on the board. Let's say a woman saw her menstrual bleeding on the 3rd of May. That 3rd of May that her period started is day 1 of her cycle. I just want to quickly say that we'll be using a 31-day calendar for this calculation. And since we're in the month of May, let's assume this is a May calendar. So this woman's menstrual bleeding started on the 3rd of May. That 3rd of May that her bleeding started is day 1 of her cycle. Then she bled for 4 days, then bleeding stopped. So 4th of May is day 2 of her cycle. 5th of May is day 3 of her cycle. And 6th of May is day 4 of her cycle. Now, I said she bled for 4 days, then bleeding stopped. The next time she sees her period, the next time her period starts is 29th of May. So now, when you want to count this woman's cycle length, you start counting from 3rd of May, the day bleeding starts, to 28th of May, which is the last day before the next period comes. So I'll number the calendar fully and then we will count. Seven. So we stop numbering on the last day before the next period starts. Now let's count. 1 from the first day bleeding started. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26. So this woman has a 26 days cycle length. Now, the normal length of a menstrual cycle ranges between 21 to 35 days. So any cycle length less than 21 days or greater than 35 days is abnormal. So if you fall in these categories, you should see a gynecologist to help you figure out why this is happening to you. Now, this method of calculation I'm going to be showing you is not for every woman. For example, some women don't know when their cycle is regular or irregular. Let me explain. If, for example, you have a consistent 27-day cycle, then in a year, you have 9 months of regular 27-day cycles. But then there were 3 months that were a bit different, like 26 days, 28 days. That is not problematic. Small changes like that or small shifts in the cycle length like that are not a problem. This method I'll be showing you is for women that, despite their cycle length falling within the range of what is considered normal, which is 21 to 35 days, their cycle lengths vary from month to month. Let me give you an example. So this woman, month 1, she has a 29-day cycle. Month 2, she has a 32-day cycle. Month 3, she has a 27-day cycle. Month 4, she has a 26-day cycle. Month 5, she has a 29-day cycle. Month 6, she has a 34-day cycle. So you can see from this example that despite this woman's menstrual cycle length falling within what is normal, which is 21 to 35 days, her cycle length vary from month to month. So this method I'm going to show you is for women with varying cycle lengths like this. Now, before you can even use this method of calculating safe days and fertile days, you need to have tracked your cycle for at least 6 months. You can track it for 8 months, you can track it for 1 year, but you need to have tracked your cycles for at least 6 months so that you'll be able to collect enough data for this calculation. We are going to be using a fictional woman in our example. This woman, her name is Mrs. J. So Mrs. J has tracked her cycle for the past 6 months, starting from November 2025 to April 2026. You can see in November 2025, she had a 27-day cycle length, December 29 days, January 31 days, February 28 days, March 30 days, and April 32 days. All these cycle lengths, despite falling within the range of what we consider normal, 21 to 35 days, they vary from month to month. So that is what we're going to use in this calculation. Now, we are in May and Mrs. J's menstrual bleeding started on the 4th day of May. So May 4th, bleeding starts. And remember, when we were counting the length of menstrual cycle, I said you start counting from the first day bleeding starts. That is day 1 of the menstrual cycle. So for Mrs. J, 4th of May will be her day 1. And we are going to identify that on the calendar. After identifying day 1 of Mrs. J's cycle, the next thing we do is to look at the record of her cycle length and identify her shortest cycle. And when we look at her record, we can see that her shortest cycle was in November, which was 27 days. We are going to use that number in our first calculation. And the formula is this: shortest cycle minus 18. So in the case of Mrs. J, it will be 27 minus 18, which will give us 9. And that 9 is equal to day 9 of Mrs. J's cycle. Now, after identifying her shortest cycle and using it in this calculation, the next thing we're going to do is come back to the same record of her cycle length of the past 6 months and identify her longest cycle. And when we do that, we can see that her longest cycle was in April 2026 and the cycle length was 32 days, which is this. So we're going to use that number in our next calculation. And the formula is longest cycle minus 11. So that will give us 32 minus 11, which will give us 21. And that represents the 21 of Mrs. J's cycle. Now, the values we get from subtracting 18 from the shortest cycle and subtracting 11 from the longest cycle have importance. they have meaning. When we subtract 18 from the shortest cycle, the value we get represents the first day of the fertile window for the shortest cycle. So in the case of Mrs. J, when we subtract 18 from 27, which is her shortest cycle, we get 9, which is day 9. And that day 9 is the first day of the fertile window for Mrs. J's shortest cycle of 27 days. Now, we are going to trace the 9 on the calendar. So I said when we want to count the length of the cycle, we start counting from the first day of bleeding. And Mrs. J's first day of bleeding in the month of May is May 4th. So now May 5th is day 2, May 6th is day 3, 7th is day 4, 8th is day 5, 9th is day 6, 10th is day 7, 11th is day 8, 12th is day 9. So this is day 9 of Mrs. J's menstrual cycle. Now, let's come back here. The value we get from subtracting 11 from the longest cycle represents the last fertile day for the longest cycle. So in the case of Mrs. J, when we subtract 11 from 32, we get 21. And that 21 represents day 21, meaning that day 21 is the last day of Mrs. J's fertile window for her longest cycle of 32 days. So we are also going to go back to the calendar and trace that day. So we stop numbering at day 9. So we have day 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. So this is day 21, and that is the last day of the fertile window for the longest cycle of 32 days for Mrs. J. So what this means is that day 9 to day 21 are Mrs. J's fertile days. So if Mrs. J wants to get pregnant, if she's trying to conceive, that means day 9 to day 21, which are her fertile days, are the days she should have unprotected intercourse to maximize her chances of conceiving. But if Mrs. J does not want to get pregnant, then she needs to be very careful on days 9 to day 21. So she should either abstain or use contraception on those days. While the other days, the days that are not cycled, are said to be lower risk for pregnancy to happen. Now, I want to say this quickly. The calendar method is not 100% guaranteed as a form of contraception. So, if not getting pregnant is very, very, very important to you, you should see a doctor to help you pick a reliable method of contraception. And with that, we have come to the end of this video. If you have any questions, please drop them in the comment section. I will try to answer them. If you think you might already be pregnant, please watch my videos on early pregnancy signs before a missed period and when to take a pregnancy test to avoid false negatives. In my next video, I'll be showing you how to calculate your safe days and fertile days for women with regular cycle lengths. I will see you in that video. Until then, stay healthy and be kind to yourself.